Are you tired of those telltale signs of aging around your eyes? Whether it's the crow's feet or just wrinkles under your eyes? Well, in this video, we're going to give you the ultimate guide on what to do about it. You can get that fresh, youthful look back. Let's start first by talking about what's really going on around your eyes. The skin around your eyes is thin skin. Take insults or things coming at you very well, right? Same thing with the skin. The skin around the eyes is very sensitive to the environment and sensitive to what we're eating. And usually you're going to see aging there first. In fact, they've done studies comparing the age of the skin around your eyes compared to other parts of your body, and they've seen it be up to 22 years older. Yes, that area is particularly sensitive, and part of what's going on is as the skin ages, it gets drier, and definitely we don't want that if we want youthful skin. Also, we lose some proteins that includes collagen, elastin, and hyaluronic acid. And those are the key proteins that are really helping to keep the skin youthful, supple, and wrinkle-free. So what can we do about it? Well, there's a few different things we can do. Starting at home, what can we do at home? One of the easiest things you can do is making sure that you're drinking enough water. And one simple thing is just drink 8 glasses of water a day. Now, they may not be enough for some people, but certainly it will meet the minimum for a lot of people. A lot of us don't drink enough water, and so this is going to help keep the skin hydrated. Again, remember, we are dealing with drier skin, so we want to do what we can to keep it hydrated. Another thing that is going to support youthful and healthier skin, particularly around the eye, is one, antioxidants, and the other is making sure we're really getting the right fats. And nuts can be helpful for that, but also you can look at supplements. So whether that be fish oil or krill oil, those are really going to help with the skin as well. So what else can we do at home? Another thing, which this is just not negotiable, is sunscreen. Remember to wear sunscreen. You're probably not just going to put it under your eye, you're going to use it your whole face, but we do want to make sure that we are wearing sunscreen. This area, again, is more sensitive to the environment than the rest of your face. So sunscreen is going to be helpful. We want to have SPF at least 30 to make sure we're getting enough protection. You might even want to wear quality sunglasses as well. This is also something, again, will help protect the area. Not least, another thing you can do at home is make sure that you are getting enough sleep. Sleep is vitally important for your health in general, but also it's going to help with skin health and maximizing the benefits we get with doing the other stuff we're doing. Now, in regards to skincare products, what do we want to do that might be a little different than other body parts or face or neck? One of the things is retinol, so we want to make sure that we're utilizing retinol. Retinol is a vitamin A product, and what it's going to do is help the skin turn over faster. The effect of that is less. Retinol will lower the appearance of fine lines and wrinkles. It will induce more collagen growth in that area, which is key because that, again, is something that we're losing as the skin gets older. Another agent or class that you want to make sure you're applying topically is hyaluronic acid. Now, hyaluronic acid is essentially a large protein, and your body creates it to help give structure to the skin, but also really to make sure that it's hydrated, and the hyaluronic acid will attract more water to the area. We are making sure our skin is not getting dry. Another class that we want to make sure that we are getting topically is peptides, and there are a few in particular that we really want to make sure we're getting. These are ones that most studied and certainly have an obvious impact. One of that is methotrexate. This is a peptide that is going to help signal the body, or particularly the skin, to make more collagen. Arginine, this is another peptide that, again, is going to help create more collagen in the area. And then last but not least are copper peptides. And what these are going to do, same thing, signal the cells in the area to make more collagen. And the theme is we want more collagen. Now that we're doing all those things, what else can we do? There's a number of treatments that we can actually do in the office, and it goes from lasers to pills. There's multiple things. So if we start with lasers, most lasers that are used in an office like ours, they can help with collagen. But really, if you want to use a laser to address fine lines or wrinkles, you're going to want to use something more aggressive. And so at a minimum, what's called fractionated laser, or even something that's stronger than that where you would have downtime, CO2 laser. Generally, if you're doing something like that, you would do the whole face. However, certainly those are more aggressive, and if we're using something ablative, it's going to have downtime. There are other things that work pretty well. One of those things is chemical pills work by, again, inducing collagen in the area. And in this area, you have the option of a superficial or medium depth pill, depending on what area exactly we're treating and what the result we want. Pills are certainly an option. Another consideration would be what's called microneedling. What microneedling is going to do is puncture the skin with these small little needles and induce collagen in that area. Basically, the body thinks it's been injured, and so it makes more collagen. This works pretty well in this area around the eyes, particularly underneath and on the sides. Another thing you do is what's called radio frequency, is essentially using radio waves to heat that area up and to a certain temperature. And again, we get the simulation of injury, and the body says, hey, we need to make more collagen, and we get the result of more suppleness and less wrinkles in that area. Now, another thing you do is what's called radio frequency microneedling, which is now we're doing both of those things together. And this is generally going to be for people who have more advanced wrinkles and fine lines, or they try something else and they really get the result they're looking for. This works really well around the eyes as well. So check this out. Those are some of the device-related treatments we can do. But also we can just use Botox. What Botox is going to do is essentially decrease the amount of muscle movement in that area. Works particularly well with the crow's feet, not quite as well if you have wrinkles under your eye. That would be one of the other treatments, or something totally different depending on what's going on. But with Botox, you can see the results of Botox within a couple of weeks, and even then you would start to notice a decrease in the fine lines. With repeated use, you will see that even get better, particularly if you're doing some of the home stuff that we talked about earlier. All these treatments work well. The issue is going to be if someone has more advanced wrinkles or deep wrinkles. Some of these may not work as well, and so you might need to consider something ablative like a CO2 laser or surgery. For people who have less severe issues, these work very well. I would normally give the topical agents a few months to really start, and if it's working a little bit or not at all, then certainly you can talk to a professional about what else you can do, including some of the treatments I just mentioned, and they can see what's the best fit for you and will really help speed up the process. If you have questions or comments, please check out what these specialists have to say about the procedures. Okay guys, check out one of these videos on retinol and skincare, and we'll see you next time.